What do you need to know about healthcare in Canada? First of all, every province has their own programs, and there might be a slight difference. And today we will talk only about Ontario health plan, which called Ontario Health Insurance Plan, and we use abbreviation OHIP. So OHIP, it stands for Ontario Health Insurance Plan. In Ontario, you can get OHIP when you have a legal status, and of course, if you're planning to come here as a new immigrant, and like you're planning to come here at certain days, you need to know that you can get OHIP only in 3 months after landing. So it's very important for you to get insurance from any private company you can find, and you can get different quotes from them to cover yourself for first 3 months, because doesn't matter which status you have, and when you come you still need to wait, and when you apply for this OHIP you still need to wait to get your free OHIP coverage. In order for you to get the OHIP card, you need to physically go to Service Ontario. You need to bring with you proof of your residency. It could be rental agreement, it could be any bill that you received for your utility services, it could be any document that shows that you physically live in Ontario at this certain address. You have to fill out few forms, and they will send you card. Even if you got card before 3 months after your landing, you still have to wait until 3 months pass after your landing here in Canada. This is very important moment, so make sure to plan ahead and buy extra coverage for these 3 months. Also, I want to mention that OHIP covers all major doctor's visits, like hospitalization. You can go to emergency room, you can get any surgery, it will be covered, like labor, it will be covered. And sometimes they have new changes. Let's say OHIP covers eye doctors for kids until certain age. I think it's until age of 18, and also for the adults after age of 65. So this is very good, because before they didn't have this option. It's like probably a little bit more than 1 year in action, which is very good. All this mentioned above is absolutely free for you if you have a OHIP card. You don't have to pay extra fees for that. We don't have a monthly plans, monthly payments, nothing. It's absolutely free for us, and it's government funded. So they use our money that we pay for taxes. So what's not covered? Pretty much fancy doctors, like cosmetic surgery not covered, massages, chiropractor, dentist, this not covered. But if you can find work with benefits, extra benefits, they can offer you certain programs that will cover up to 80% of these services, which is great. So when you're looking for job, you have to ask your employee if they have this coverage. That's actually a very great feature, because dentists, let's say, pretty expensive here, so it's good to have it. And also eye doctors, as you know, eye doctors not covered for regular people, adults of age between 18 and 65, and again it's very expensive as well. We're gonna leave a few links down below so you can see more detailed information, and if you didn't subscribe to our channel, it's a perfect time to do it right now. And if you have any questions, don't forget to leave us a comment. Bye now.